on behalf of Bharat Ganit Parishad, myself, and the Department of Mathematics and Astronomy, I welcome from the bottom of my heart to this department and all of those for this webinar and technical session on mathematical modeling and the pandemic. I would initiate the things with the word that pandemic is, today it's a means of all the economic, political, social disturbance, and we all are eagerly waiting for some sort of vaccine so that this pandemic ends, in fact. So, without wasting any time, I will request Professor Poonam Sharma ma'am to please welcome all the guests. So, before that, I would request Dr. Mukmar ma'am to offer deep Prajwalan and Saraswati Vandana. Mathematical modeling has shown its importance in the study of problems related to the sciences, biological sciences, social and political sciences, etc. It has been one of the major tools, not only in predicting the effects of the pandemic virus, but also has been able to suggest possible control measures for this pandemic. The economic, social, and political effects during the lockdown period were also evaluated with the help of mathematical modeling. As such, Bharat Parshad and the Department of Mathematics, University of Lucknow are jointly organizing this webinar and technical session, whose focus would be mathematical modeling, dynamical systems, artificial neural networks, econometric investigations, etc. So now I would request Professor Poonam Sharma ma'am, Head Department of Mathematics and Astronomy, University of Lucknow, to say a few words.
Good morning, all of you. On my personal behalf, I welcome you all, present offline and online, in this inaugural function of the webinar. Webinar is on mathematical modeling and pandemic, which is jointly organized by Bharat Parshad and the Department of Mathematics and Astronomy, University of Lucknow. It is a great pleasure in organizing this webinar, as this platform will provide an opportunity to listen valuable lectures and to share our research work. This webinar will be of 2 days, in which we will listen 4 speakers on the topic of the webinar. Our speakers are Professor Somesh K. Mathur from IIT Kanpur, Dr. Prashant Kumar Srivastava from IIT Patna, Professor Rana D. Prasad, Iowa State University, USA, Professor Arvind Mishra from PHU. Presentations of research work will also be there in both offline and online modes. The topic chosen for this webinar is very relevant in this pandemic. This pandemic, COVID-19, has put mathematical models in the spotlight. Mathematical provide clarity and enable to make comparison between the consequences and the basic assumptions. The socio-economic impact of this pandemic everywhere can be analyzed and predicted. The technical sessions will expose us to understanding of how impact of pandemic can be projected and also help the practitioners to monitor and control the causal variables to prevent the disease. I'm sure the sessions would be enriching for all of the participants and enhance our understanding of practical approaches to applying modeling to real-life challenges such as pandemic. Thank you.
Thank you, ma'am, for your nice words. We very nicely explained about the theme of this webinar. Now I would request Professor Manju, President of the Society, to deliver her presidential address.
Thank you, Professor Mathur. Professor Poonam Sharma, and Department of Mathematics, Professor Pankaj Mathur, the Secretary, Bharat Parshad, other office bearers of the society, dear students and fellow mathematicians who are listening, attending this program either in person or online. Actually, it's indeed a privilege for me to have been associated with Bharat Parshad for last 3 years as president, almost 3 years as president of the Parshad. Though my connection had been with this society since maybe I was a student at IIT Kanpur, from where we used to come to attend annual meeting of the society. And I'm really happy that this trend is continuing. And for electing me as president, I feel I'm thankful to the members of the Bharata Parishad who are spread all over India as well as abroad. Maybe number may exceed 500 or so. Now, regarding Bharata Parishad, I would like to say it is one of the oldest societies which came into existence in the year 1950 under the leadership of Professor Singh, Krishna Singh, who was head of the department of this department at that time. Though it was, Professor Ganita had started Banaras Mathematical Society, which was located at Banaras, Varanasi, but just to revive it, maybe it must not be continuing properly, whatever the reasons for it was brought to this place, and Professor Singh really revived it. And in fact, Banaras Mathematical Society was initiated in 1918, but actual work of this Bharat started in 1950. And since then, we have been holding conferences, annual conferences, publishing journal and other books. The purpose actually of any society is especially to promote the subject. The same thing was true with Parishad. And how do we achieve this? How do we promote any subject? By holding conferences, publishing journal, or by holding symposium, etc. So that we can, our students and the persons who are working in that area become familiar with the current investigation, and as well as also, this is our purpose also to tell the old things like what has happened earlier. And in this direction, the beginning of the society was Hindu mathematics. I think several books have been written by great Professor K.S. Shukla, who happened to teach me. Here, in fact, I'm alumnus of this university. I did BSc from here. So he has written several volumes, in fact, edited as such the work done on Hindu mathematics, and I think it's available in our library here. Right? And those who are interested in that mathematics, they can go and say, but paying minimal amount. And some, I think, manuscripts are also available. That's what I was told by Dr. Margaret, which you have to see the digitization. I mean, it's only manuscript, handwritten manuscripts are there. See, many stalwarts in working in mathematics have been associated with this Parishad. To begin with, I will start, especially Professor Swami, R.S. Verma, Gorak Prasad, D.B. Narlikar, B.R.C., Professor Hudud Bazar, J.M. Kapoor, and Singapore, I already mentioned, Professor Ram, and R.S. Mishra. The same list is pretty long, Professor A.D. Singh, etc. List is pretty long, and I think I did not name everybody, but those, they have helped us in bringing the journal Ganita to a level of international repute. They have either served as office bearers or as editors of the journal. when the Parishad or society was initiated, we didn't have many branches of mathematics. Now you see number of branches. The subject is being, nourished further and, is being, expanded further and further, and we have to nourish it. How do we do it? It has become more demanding, in fact, because, see, we have the branches like, what should I say that, wavelet theory, mathematical modeling theory, dynamical systems, fractal analysis, cryptography, and now recent one is pandemic, which is for which mathematical modeling is playing a role, and how it has affected our life that you have to see here. So when this advancement in mathematics has become more demanding, then what should we do? So in this direction, some societies of India decided to have joint ventures. Especially, I think BJP has collaboration. They have collaborated with the Indian Mathematical Society for giving lectures in the department for presenting the work of earlier mathematics as well as maybe current eminent mathematicians. And I think it was initiated in 2015 or 16, yes. And in this lecture of series, the work of Professor V.K. Patodi, Meenakshi Sundaram, etc. were presented. However, I wish that this trend should continue, and I also wish that the department should have, workshops, etc., under the banner of BJP for 10 days, 15 days workshop under the banner of BJP for students, so that they can become, however, they become aware of the present, researches and what is happening around us, and just to educate them with the current situation, current advancements, etc. So the workshops for 22 days would definitely help the students. This, I wish, it should start, right? Maybe we have been having refresher courses, etc., in academic college, but that is a different issue altogether. But under the banner of PPP, we wish that we must have that also. I think earlier it was there, if I remember correctly, especially when Professor K.D. Silva, they were holding some positions in the this VGP. Lastly, what I would like to say, that the popular and technical lectures on current topics, which I have already mentioned for workshop, but now lectures, popular and technical lectures on current topics should be organized to create awareness about the importance of mathematical sciences, and the present webinar is an attempt in this direction. But it's already there. Webinar on inductive on mathematical modeling and the pandemic is an attempt in this direction, which is being held under the auspices of the Department of Mathematics and Modern Construction during the centenary year of the university. I think, as you know, centenary year means the department was, initiated when the university started, was probably in January 1924. And that time we were not free. It was the government, British government, which, they were instrumental in initiating this university. Now, I wish all the success to this session, technical session, and I'm happy to know. Thank you.
lovely words. Your suggestions for the upliftment of mathematics as well as Bharat Ganit Parishad are really appreciable. And I'm sure with the help of the heads, Professor Ganita ma'am, and with the help of all the members, faculty members, and the students, we will be able to achieve most of the goals which were assigned. Before giving the vote of thanks, I would like to say a few words about the journal which Bharat Parishad has been publishing since 70 years. So the name of the journal, as you all know, is Ganita. Uh, this journal, Ganita, we are publishing the 70th volume of this journal, and it is published online as well as we are publishing it and distributing it among the colleges recommended by the UPCST. Also, we are getting about 60 odd journals in exchange of Ganita from all over the world. Uh, the publication, we have a very minimum publication charges for this. And what we do is we promote the authors to become the life members of Bharat Ganit Parishad in that way. I mean, if a member is trying to publish a paper in Ganita, then we are charging like 250 rupees per page. And if a non-member is interested in publishing a paper in Ganita, we are charging like 550 rupees per page. So I must say that we are trying to promote membership of Bharat Ganit Parishad as much as possible. So one more thing, the journal is approved. Is reviewed in mathematical reviews. It is in MathSciNet. Also, it is in the list of UGC clear list. So, and nowadays, I must say that efforts of the editor and editorial secretary, it has tried to reach to the heights it was having at some time. So, now the time is to give a vote of thanks. And first of all, I must thank to all our speakers, Professor Sumesh Mathur from IIT Kanpur, Professor E.K. Srivastava, Prashant Srivastava from IIT Patna, Professor Rana Prisad from Iowa State University, USA, and Professor Arvind Mishra, who very gleefully accepted to present their papers. And I must appreciate their sincerity regarding this technique. A few of them did a mock test yesterday for this webinar, as they were new and we were also very new for this sort of electronic media. I'm thankful to all my colleagues, Professor Rajaram Yadav ji, Dr. U.S. Rajput ji, Nidhi Pandya ji, Dr. Anupma Rastogi ji, Swarnima Bahadur ji, Lekha Srivastava ji, Sushil Kumar ji, Alka Mishra ji, Anand Vallabh Joshi ji, and all of those. Virendra Srivastava Sahab, he's a student of this university and has done PhD under Professor K.K. Mathur Sahab. He was the first student of Mathur Sahab. So I'm thankful to all these guys who have took out their precious time during this pandemic and are here. I'm also thankful to all the members who are connected virtually for this webinar. I'm thankful to all the executive members of the Bharat Ganit Parishad who always are helpful to me and are always there to give me ideas to organize this sort of, academic collection of mathematicians and allied subjects. Students, without students, nothing is possible. I'm thankful to Hareen, Varun, especially Varun and Hareen, and all the other students who helped me to organize this session and all the technical issues. Last but not the least, I am very much thankful to my younger daughter, Rishita. She's not here, she's in a room to me in the sense that the telecast, this live stream of this program is being done on YouTube, and she is the in charge of that. I'm thankful to her. Yeah. So, again, lastly, all the office bearers, all the employees who have helped me for organizing this, I'm thankful to all of them. And we have a small debate after this. I hope all of you would enjoy that. Thank you very much.
Good morning, Pankaj ji. Good morning, everyone.
forward to is the recovery rate of more than 94%. But worrying are still the daily cases of, say, 30,000, not like September where we had 97 lakh cases in a day. Uh, 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 so, and at this rate, we would have in India around 11 million cases by end of January 2021. And by March, at least we may have around 1% of our population being affected by the COVID cases. So the question that we pose in this study is that could we have done better? Could there have been a better way which could have ensured lives and livelihoods for all? Now we know that we are reeling under the health, economic, and security crisis. Health, because of the grand lockdown that we had from March 25th through May 30th, where we had four set of lockdowns. Economic crisis, because the lockdowns had an impact on the GDPs. Last quarter, we saw minus 23.1 GDP growth rates. This quarter, quarter three, we will see a decline of 7 to 8%, but in a year, we will see 10% reduction in the GDP. So, this mutating virus is known for its speed, scale, scope, seasonal, and waves of re-emergence, spread, and gross uncertainty regarding its termination. If we go back to the history, Spanish flu from 1918 to 1920 affected 500 million people. And at that time, the population was around 1800 million people. So 27% of the population got affected. This time, in India, we will see 1% of our population getting affected. World would see around 0.87% of the world being affected by this this virus, but it has played havoc with our health systems. So the issue is governance and health management. So what we also do is that we go into what causes the spread of this virus across countries and in Indian states and districts. So this is the motivation behind the study, keeping in mind that rich countries with better health capacities and lower population densities were impacted more, at least initially. And because we have daily data across 215 countries, COVID affected countries, including Indian states and districts, we have daily data for the past 7 months of COVID cases, COVID recoveries, COVID fatalities, and its determinants. So we see we are analyzing the daily data of the COVID cases, and so we employ the technique of ordinary least squares with robust standard errors. We also use count data regression. We use spatial regression. Because it's a time series data, we use the feasible generalized least squares. We have daily data, but we have 215 countries as well. So we employ panel regression. And then we also employ artificial neural network to account for the changing data every day. So, broadly, the objectives of the study are the causes of COVID 19 spread across 215 countries of the world, 35 East Asian and Pacific region, 54 African nations, 27 EU nations, and 19 Latin American regions, and then 33 Indian states and 733 districts of India. And then we also wish to analyze why were developed nations impacted more economically and in terms of healthcare, health crisis initially. And then the focus of this study would be how much should we relax the lockdown measures, keeping the spread minimum? This is the most difficult question that the governments are facing. And then, did lockdowns impact more of GDPs, that is, livelihoods, across countries, or the lives in terms of COVID cases, recoveries, and fatalities? At the end, we then pose the questions: what lessons can be learned from other countries which had managed lower COVID 19 cases, especially Oceania and some East Asian nations had low COVID cases. So, can some lessons be learned from these countries? And then areas of collaboration in these difficult times during and post COVID 19 pandemic. And what we suggest is alternative development model of social entrepreneurship, comparative advantage, shifting comparative advantage in our own favor, that is the Japanese flying geese model, through rural and agrarian transformation with balance between ecology, skill training, environment and growth connectivity, and self-sufficiency to mitigate this health security and economic crisis. So these are the objectives of the study. So at this juncture, let me take a break for half a minute and ask you if there are any queries at this stage, because now I'm going to run through my slides and share the results with you, starting from the mathematical model of SEIR to all the econometric models, and then ending up with the artificial intelligence deep learning model of artificial neural network. So should I continue? Pankaj, are you there? Should I continue?
Sir,
Yeah.
am I audible?
Yes, yes.
So one of the participants, our president is asking, what is the source of your, talk?
The data, the source of the data.
Yeah.
Yes, the source of the data, there will be a slide on the source of the data. It is John Hopkins University, and they collect the data from the World Health Organization. So there are slides which will have all the data sources, because the focus of this study is on the spread of COVID 19 and its macro determinants. So I will share these slides with all the participants. There's already two papers on this. Uh, uh,
I will share that those
yeah,
papers.
please do distribute it to the attendees.
Sure, sure, sure.
All right, thank you for this question. So I will now proceed. So the literature review, if you go back to March of this year, there were lots of forecasting done by ICMR, Indian Council for Medical Research, and then there is an organization in US called CDDEP, and their forecast about the COVID infections were that in India, the population which may get affected could range from 1% to 10%. Okay, so 1% would mean 13 million people, and 10% would mean 130 million people out of our population of 1300 million people. So that may be the reason that we adopted very stringent lockdown measures, and uh, that was the forecasting model that they used, and also the government of India has been using, is the SEIR model: susceptible, exposed, infected, recovered model. Now, this is the mathematicians all participating here would know that this is like a non-linear differential equation. So that second paper that we mentioned, which is published in the journal, solves this SEIR model. But there are two other interesting studies. One by Alvarez, NBER working paper, which talks about the the fact that what lockdowns can do, what the lockdowns can lead people to be confined to home, and without testing procedures, what they what it means is they cannot resume revenue generating activities, which results in a permanent decrease in per capita GDP. So this is how lockdowns can impact GDP drastically. Another paper, same National Bureau of Economic Research, Gingerek, says that institutional and demographic dynamics lend evidence to the fact that regions with greater share of senior citizens, population employed in unstable occupation, a greater degree of democracy, as well as distance away from the equator, exhibit larger sensitivity to the effects of lockdown measures. So we're going to test all these using our data set, which is for all the COVID affected economies, 215 COVID affected economies, including Indian states and 733 Indian districts. Uh, the other
Echo is
good
coming.
study is on the COVID 19 India National Supermodel Committee, which is also trying to forecast the COVID infections. And they've used extended SEIR model by considering different scenarios, and claims that lockdowns in India have worked, and reverse migration did not significantly impact the COVID infections in India. In this, we had some professors from IIT Kanpur as well, and also medical doctors from the army, Lieutenant General of the rank of Lieutenant General, and they also went into the question of uh, when would the peak occur, and they claim that the peak has already occurred in September 2020. Importantly, the scenarios that they built are of no lockdown or delayed or early lockdown, but no partial lockdown. So that is the focus of our study, that we could have had partial lockdown right at the beginning, and we wouldn't have seen what is happening today, around 10 million cases in India. We could have avoided reverse migration if we would have adopted partial lockdown right at the beginning. So I will try to detail this point of the partial lockdowns. Their projections uh, about the COVID cases vary from 1 to 10% of the population, and they also forecast 30% of our population have antibodies. Younger population and care of elderly in India have worked in India, and their herd immunity, which comes from the SEIR model, is at lower levels. This is very interesting because SEIR model does two things. It gives you that value of R, how much is a single person infecting others. If that value comes below 1, then it means that you are not infecting others. But if it is greater than 1, you are infecting uh, the 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 other people in the society. This SEIR model also helps you to get the herd immunity. So our calculations have shown that this herd immunity comes at 10% of the population. This is also quite important in the discussion of the vaccines availability. If you're thinking that the vaccine availability will come for all 1300 million people, you're mistaken, because the focus will be only on the herd immunity, that is 10% of the population, and the people who will get it first will be the frontline workers, the doctors, and the people with comorbidity. So the idea of herd immunity is that if, say, 10% of our population, say 130 million people, uh, are not able to infect others, then it means that the COVID infections has subsided. There's also IMF study which also claims that lockdowns have helped the countries. Our study is in variance with all these claims that lockdowns have helped, because what we are saying is that partial lockdown uh, would have helped. So we are questioning the design of the lockdowns. There are other also interesting studies by Bayer. He works with the World Bank office in New Delhi, and they've used high frequency data of night light uh, intensity index and the Google mobility index. Now, these are indices which uh, uh, which are indicators of the economic activity happening in the economy. And they are trying to reason out that what has happened. Sorry, if there's a question, please.
कि इसकी आवाज कैसे बंद हो गई इसमें?
Is there a question? Uh, are you able to listen to me?
Please continue, sir. There was a somebody was.
All right. Are people with their smartphones and visiting, say, grocery stores, pharmacy, parks, recreation, and how many people are confirmed with COVID-19 in So there are some interesting results by Bayer. I've put this in the references. There's also a study by Bayer, also Bayer et al. And here they're talking about nighttime light data. Nighttime light data is illumination data. So say if you take a flight from the Lucknow airport down, you see where there is concentration of light, and they interpret this as an index of activity, economic activity. And so what this lockdown has done is that it has restricted activities, all these economic activities. So GDP is drastically impacted by these lockdown measures, and they are more uh, uh, having stringent impact on the districts with greater population density of older residents, as well as more services, employment, and bank credit. So now our work starts. This is that we have also used the nonlinear differential equation SCIR model: susceptible, exposed, infected, recovered model to forecast. These are projections of August, and we also bring in one more addition. We say that this SEIR model, but we also bring in what happens if there is social distancing. So if you look at the third column, and if you have business as usual, then we will have 13 million cases. We would have had 13 million cases by August. So if there was no lockdown, no social distancing, we would have had 13 million cases. With some social distancing, around 12.5 million cases. And with uh, people adhering to social distancing, we would have had 5242483 cases by the end of August 2020. What is important is that when we calculated R0, the reproduction rate, the rate which tells you that as an individual, how many people are you infecting, that value has come down from 3 to 1.04 for India. So the point that we raise here is that even if the R value is going down, why are the cases going up in India? Or at least uh, till last month, or till date, we have seen cases rising. So the government of India can take a comfort by saying that we are not testing enough. What we are saying is that there are socio-economic, political reasons behind the rise of COVID cases in India, including the lockdown measures that we had, which we say that it was faulty, the design was not proper. The herd immunity can also be calculated putting the value of R0, and if you put 1.21, the herd immunity comes out to be 17.35%. If you put R0 to be 1.04 as what it was last month or last to last month, it will come out to be around 130 million people. As I said, this assumes importance because even for vaccination, I think the government of India, they will not say it, but only 10% of the population will get vaccinated, because the idea is that once they get vaccinated, they will not be able to, community as such will not be able to communicate the disease to all. So this is what we are saying, that the R value has come down for India, for US, Spain, and Italy, but still the COVID infections are going up. So what we say is that there are a host of socio-economic, political, environmental reasons for the spread, and lockdown stringency and lack of testing may be one of them. Why this is important? Because forecasting is important because that will help us to know how many hospital beds and health worker requirements are required given the projections of infections, cured and fatalities. So then we identify what factors have explained the COVID spread from uh, the air transport passengers carried, because this is what triggered the COVID spread. Lucknow, for example, has 70,000 cases. Kanpur has around 30,000 cases. So UP, which has 5,50,000 cases, around 1 lakh cases are in Lucknow and Kanpur. Okay. So what's the reason? Air transport. One, democracy. Does financial, does administrative and political decentralization helps in limiting the spread of COVID? Does temperatures matter? What the US president has been saying, population density is the cause. Is that the reason for the spread? Is tourism the reason? Is corruption? Is regulatory quality? Is gross debt? The Nobel laureates, Professor Esther Duflo and Professor Abhijit, has been saying that increase gross debt because that would reduce the COVID infection. So you borrow, whether from abroad or from within the country, or you print notes. But this is required so that you use fiscal measures to increase aggregate demand in the economy. Then the vulnerables are population age 65 and above, then nurses, then capital health expenditure. You will see that this measure is quite important across the country. It's like a double whammy. It reduces the COVID cases and increases the GDP, then hospital beds, then BCG immunization, then malaria incidence, then physicians, whether undernourishment and poverty uh, leads to higher COVID cases, urban population share. This will assume importance because you will find that this COVID spread is an urban phenomena. Then general government health expenditures, and then we have other controls, we have instruments because we use IV and GMM for our work. So this is the stringency index that we use. And stringency index is calculated on the basis of the following: school closing, workplace closing, cancel public events, close public transport, public information campaigns, restrictions on internal movement, international travel control, and then fiscal and monetary measures, emergency investments in healthcare, investments in vaccines, testing framework, contact tracing. So here, let me pause and say that what we are saying is that we could have had partial lockdown right at the beginning. We could have had 1 to 7, and we could have relaxed the measures from 8 to 13, which would have allowed us to use fiscal and monetary measures to increase aggregate demand in the economy, have investments in vaccines, testing, contact tracing, emergency investments in healthcare could have been done right at the beginning, or we could have planned for that. I still remember that 3 to 4 months back, we were importing PPE kits from abroad. And now, of course, IIT Kanpur has taken a lead. Disinfectant machines we are producing the face masks, PPE kits, and others that we could have done right at the beginning. Okay, so that grand lockdown, it seems, did not work. So this was our hypothesis. So let us test it on the basis of the data that we have. We have daily data across 215 countries, which is changing every day. So we need to use some models so that we can analyze that properly. And therefore, this artificial neural network, which mimics the brain activity, is quite helpful, because your human brain is quite good in understanding relationships, in recording past behavior, in face recognition, human recognition. So that's one of the reasons that we use the ANN, and we say it that we do it to account for the changing data. So that was the challenge. Now, here are some non-parametric plots which tries to link the COVID cases with all its determinants. So we find that active cases and GDP per capita, there's a negative relationship, although this relationship is not robust. Then we see an inverted U relationship between GDP per capita and stringency, average stringency index. Again, not very robust. But what is robust is that debt to GDP, what Professor Esther Duflo and Professor Abhijit, the Nobel laureates, have been saying for past 6 months, that you borrow, whether you borrow from abroad or within, this will lead to higher recoveries, reduced COVID infections. And, and then importantly, capital health expenditures reduces total cases. It's those big machines in the hospitals, those ECG machines, those those the big machines which are required for cancer detection. Uh, and it also points out that this virus is it may affect lungs initially. It is pulmonary at the beginning, but it ends up affecting the entire body. It's vascular. So capital health expenditures are more important. Then, importantly, if you look at the average stringency and active cases, there's an inverted U relationship, with the peak occurring at 70. Now, the average stringency index for India has come down. It is around 48. So we are uh, opening up, and therefore relationship tells you that the active cases are going down. It has reached around 3,59,000 in India. Okay, and remember, the total COVID cases are around 9.6 million, but the active cases have come down. So this is some indication that Stringency and active cases are related with each other. Mobile broadband services helped in reducing the cases. Then, what is interesting is that this democracy index, which has come from the Economic Intelligence Unit, this has a positive impact on GDP per capita. And population density across 215 countries has a negative impact. I repeat, a negative impact on active cases. So it means that this population density is capturing the public information campaign. And that is so important in countries like India, where the share of rural population is quite high, where they require the information regarding these COVID infections and what to do once you get infected. And immunization. Remember those these vaccines that you got for curbing tuberculosis? That helps. But that was given when you were young. So again, with these vaccines which have come, what you need to see is that for how much time will the antibodies stay? That's very crucial. Besides the vaccines that we have, we should have vaccines which have very mild side effects. Okay, we need to see whether uh, they're causing allergy, uh, like the ones like the Sputnik, which has come in Kanpur. Okay, but you know, they will not apply to people who have lot of alcohol. Okay, so these are things, these are new things which are these are new vaccines, so people don't know much about it. So there definitely there will be uh, the side effects, and it will not be given to everyone. And that herd immunity, which has come from the mathematical model of SEIR, tells you that 10% of the population will get vaccinated. So this is the faulty design of ours. If you look at Spain, Germany, Italy, and UK, they had they unlocked the economy when the cases were going down. It is only India which unlocked the economy from June onwards when the cases were increasing. Remember, in September, we had 97 lakh cases in a day. Okay? Uh, uh, so that's the faulty design of the Indian lockdown. Will choose the weight which will minimize the loss function. But then the weights keep loss function is minimized to the maximum. So that needs to be divided into training and testing frames. Uh, these are details about the artificial neural network. What it does is that it has the weighted uh, value of the inputs plus the bias, which is now converted into output through the activation function. And the activation function, in most of the time, in our case, is sigmoid function. Remember the sigmoid function 1 upon 1 plus e to the power minus z. Okay. So this is what it does. It converts inputs into outputs through the activation function. And in the middle is the hidden layer. And the technique that is used for solving is the backpropagation algorithm. We also use the Poisson regression for count data, and you can see that one of the requirements are that it should be rightly skewed. So we have used the count data regression, the Poisson and the negative binomial. Count data are non-negative integers. They represent the number of occurrence of an event within a fixed period. And at the end, they use the maximum likelihood estimation techniques. We also use the spatial regression because we find that closeness matters, especially in case of India, where there are at least 200 districts which have uh, neighboring districts. Uh, so closeness matters. It's a matter of detail. You have to construct a weighing matrix, and that is applied to the dependent, independent, and the error. And then this is the Zelener's feasible generalized least squares. If you have to account for the time series data, you have to take care of autocorrelation. And so GLS is OLS applied to the transfer.
Mine are not here. Sir, beta by alpha and what is isomorphic? Sir, please
Oh,
explain
okay.
this term.
Okay. That this beta and alpha, beta is the infection rate and alpha is the mortality rate. Now, remember when I said SEIR,
Okay, yes.
susceptible, exposed,
In,
infected, recovered.
yes,
So
sir.
you have a differential equation for each one of them.
Yes, sir.
And each one of them will give you some parameters. One parameter is beta, another is alpha. So by solving those equations, say second and third, you get that parameter, and that beta by alpha will give you this R0. And
Okay.
R0 is that famous reproduction rate.
Yes, yes, sir. Yes. Sir, so in the term R, you write here R not into S. Sir, what is S? This is susceptible.
No, 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 no. This is another parameter which is defined for this. And remember, social distancing. We bring in social distancing. So we say that R0 is approximately equal to R in case there was no social distancing. So S is 1.
Okay, sir.
That is business as usual. Then we bring in what happens if there is social distancing. Then what happens if you have more people adhering to the social distancing norms.
Okay. Sir, basically, what is the major difference between basic reproduction rate and effective reproductive rate?
Effective is that effective reproduction rate that depends on the quality of the susceptible compartments in terms of previous exposure, general health levels, nutrition, and all these. So what you're trying to say is one scenario where you are operating on a population which are all healthy, and on the other hand you're talking about a population which have say some comorbidities, uh, uh, their their nutritional intake is different. Then as we say that in our case,
In the paper which Professor Mathur has published, he has given a lot of details in that paper. If you want, I can send the paper to you, and you may
Yes,
go through
yes,
it, and
yes,
so
sir.
that you
Sir,
can. And he
please
has
send
explained
PPT also.
Pardon?
Sir, please send this PPT also.
Okay, sure. You please send your name and your email addresses. I will send it.
Okay, sir. Thank
Any
you,
other
sir.
questions from the audience? So, in that case, I would thank Professor Mathur for his great talk. His thought regarding this lockdown is really great. I mean, we all are. We are none of us sitting here is an economist, but the way he has shown this lockdown to us has really developed a picture which was somehow not known to us. So we always were saying that the lockdown was the best thing which could have been done during this pandemic to save ourselves. All right, the economic part was badly affected, but still, to a layman like us regarding economics, it felt that saving life is the most important point. But yeah, the economics of the country has gone back a lot, and it might take again a lot of time and efforts, and again monetary, help to revive the things back to what it was. And what I feel is the life which we were living like before pandemic. I mean, in February, we might not be able to get back to that in any case. I feel like that social distancing and masks are now are a part of a dress, and without that. I don't see these masks getting removed so early. So I must thank from Bharat Ganit Parishad. We all are thankful to Professor Somesh Mathurji for giving such an interesting talk and letting us know about the economic conditions of the lockdown during this pandemic. Thank you very much, sir.
Yeah, it's a pleasure, and gives me. Let me also thank Dr. Pankaj Mathur for giving me this invitation in the Department of Mathematics and Astronomy for inviting me.
Sure. Thank you very much.
Sir, can you
Yeah. हाँ बोलिए प्रवीण जी.
how to assure that our model, sir, how to assure that our model result is valid?
How to assure that your model is
How
valid?
to assure that
Uh-huh.
model result is valid?
I don't know. Professor Mathur has heard
This
it.
is my question actually, sir.
Yeah, we have done all diagnostics also. Now, I don't know which model are you talking. If you're talking about SEIR, this model is a deterministic model. It's a mathematical model. It does not have the random component, and therefore we had to shift to the regression model, that is count data, then the spatial. Now I understand that there are econometric issues: endogeneity, multicollinearity, specification. So multicollinearity diagnostics, we have put it in the paper. Then endogeneity, as I said, for health expenditures, you replace it with capital health expenditures, because a simple researcher, when he regresses number of doctors and health expenditures on COVID cases, it turns out to be positive. So there is something wrong. So in econometrics, this is a problem of endogeneity. So you take care by taking the instruments, and the best instrument are capital health expenditures. Then specification, bias, how many explanatory variables and things. So we have covered this all in our paper. Please see those papers.
If you want, I can send the paper to you as well. I will send it to all the participants. Okay, thank you very much, Somesh Mathurji,
Thank you, sir.
for your lovely talk.
Okay.
So, so the next speaker today is Professor Prashant Kumar Srivastav Sahab. I hope he's in here.
Yes, I have
Yeah,
joined.
yeah. Prashantji, hello.
Can you hear me?
Good morning.
Morning.
Afternoon. It's afternoon, 1 p.m. So, good
Okay,
afternoon, Prashantji.
Good afternoon, everyone.
So, Professor Prashant is from IIT Patna, and he will be talking on the modeling of COVID-19, its menace, and so without taking any moment, I request Professor Prashant ji to continue with his talk.
Thank you, Varanji.
Share your screen and all.
Yes. I am just sharing my screen. So, I hope my slides are visible. Can you please confirm whether the slides are visible?
Yes.
Okay. So, once again, a good afternoon to all of you. I hope I am clearly audible to all. So, after that very interesting talk by Professor Mathur, which was relating the economics of the COVID-19 and other control interventions. I'm also carrying this forward that the modeling aspect of COVID-19. And we will be talking about certain inferences and the control applications using a purely mathematical model. So at the very beginning, I must acknowledge that this presentation is based on collaborative work, which is a paper which is published in Mathematical Biosciences and Engineering. These are my co-authors, Akhil Srivastav, Dr. Pankaj Tiwari, myself, Professor Mini Ghosh, and Professor Yun Kang. So the content of this talk are basically from this paper, and if you are interested, you can have a look at the paper, and then you can see more details there. So I would like to thank Professor Pankaj Mathur for inviting me. And also I'm thankful to my teacher, Professor Manjul Gupta, who happens to be the president of the Bharata Prisad. And the entire organizing team, I'm thankful to them. So this talk basically starts, or it is actually divided into these sections. And my basic aim will be to discuss and develop the model, and also get the inferences out of the model, and draw the conclusion which we felt relevant out of the model. So before I begin with the model of the COVID-19, I thought that it will be very important to provide some insight about the mathematical modeling. The importance of mathematical modeling in the real world problems is undisputed. And very recently, we have seen the application of mathematical modeling in almost all areas of engineering, applied sciences, economy, finances, management. Anywhere you will find that those applications are there. Why this has become such an important tool? Because alternative mechanism can be explored via mathematical modeling. And you don't need to, resort to the costly or ethically impossible experiments. And you can do the theoretical experiment, you can do the simulation, and then you can get the inferences quite easily. The models generally are used to generate the quantitative predictions and qualitative insights. And these two are very important ingredient when you are going to make any kind of prediction or any kind of, you want to take the inference from the system. So the kind of model which I will be talking about, it is that means whatever is the mathematical knowledge you have, you use the mathematical tool and convert that real world model, which is approximation of the real world problem, into a mathematical model, which are symbolic representation or the representation in terms of mathematical expressions. Once you are in this mathematical world, you have the knowledge of mathematical world, and then you can either solve it, or you can simulate it, or you can do whatever mathematical tools you have. You can apply those tools, and then you can draw the conclusions out of it. And then once the conclusions are drawn, then definitely you need to match those conclusions with the real world problem. So if your problems conclusions are matching with the real world problem, that those matching can be a data or a pattern or any kind of, so that there are tools which will help you to understand that whether the comparison is suitable or not. And if it is suitable, then we say that we got an adequate model, and this is what is going to work for us. So this is the whole process of mathematical modeling, which we usually perform when we are going to model a system. So these ideas of mathematical modeling are very old in case of disease dynamics, and it dates back to the famous model of malaria by Sir Ronald Ross. So as Professor Mathur has talked, Sumesh Mathur has talked about the SIR or SCIR models in his talk. So I'll be taking you forward on those lines. So those are very common models, and most of the models are actually modified version of those basic models, SCIR or SIR type models. So before we get into that mathematical aspect, we wanted to discuss a bit about the infectious diseases. Diseases are mostly caused by pathogenic microorganisms. For example, viruses give rise to HIV, influenza, and very recently this COVID-19. Bacteria give rise to tuberculosis, anthrax, etc. Protozoa give rise to malaria, trypanosomiasis, and there are so many diseases. So that the microorganisms give rise to various diseases. Why this is important? Because we must understand that how a disease transmits and what is the fatality of the disease. So this helps us in understanding of the disease dynamics, and this helps us in understanding the severity of the disease, which we need to assess. The disease can be spread directly or indirectly from one person to another by respiratory droplets. That is, the mode of transmission can be via respiratory droplets, via body secretions, via vectors, for example, flies or mosquitoes, or via contamination of food you take, or the water, contaminated water or food you take. So this is how different kind of diseases are transmitted from one individual to another. So when we look at the epidemiology of a disease, it's a very important factor, because this only helps you in controlling and eradicating the disease. So the last point here, an in-depth understanding of the pathogen as well as the epidemiology of the disease helps in control or eradication of the disease. So these factors are quite important when you are going to study. What are major impacts? So some of the major impacts I have listed here. The diseases, infectious diseases especially, they are leading cause of mortality and morbidity. They cause around they contribute to around 1/6 of the total deaths worldwide. Diseases pose serious socioeconomic consequences, and I think I don't need to elaborate much on that, because just before my talk there was talk on the economic aspects. And I'd just like to underline that this COVID-19 has impacted that the social life as well as the financial ecology of the country. And these impacts, I mean, I have listed a few here, but we all know that there are so many other impacts. So the impacts are related to healthcare, travel, employment, and there are social impacts. So people don't meet others, and the social life is being impacted. So diseases do have the socioeconomic consequences. Control interventions, I will talk briefly about some of them. If available, they do improve quality life of individuals, but they still pose a significant economic burden. So if you want to implement the control intervention, there will be a repercussion for that intervention, and that corresponding economic burden will also be there. And therefore, one has to choose that which kind of control intervention one should use. And therefore, we can say, I think that we can safely say that diseases do have major impact on public budget and policy. So the government will closely look at that how diseases progress. And therefore, the prediction and control becomes very important for that. So there are certain control interventions, pharmaceutical and non-pharmaceutical. I think some of you might have heard about it. So pharmaceutical usually are those control interventions where you use the drugs, and non-pharmaceuticals are those interventions where the drugs are not used, but the interventions are there in order to control or eradicate the disease. For example, treatment, this is categorized as a pharmaceutical intervention, but in certain diseases it may be available, in certain diseases it may not be available. Even if it is available, then it may not be available to all. That means there will always be a limitation of the treatment. So it will be restricted to the number of beds usually, and therefore it will not be available to all. So that means if the disease spreads very fast, then this only treatment strategy may not be very helpful, because the beds maybe, I mean, the entire system might be overwhelmed and all the beds might be taken, and then that may create a problem. That has happened in some countries in COVID-19. Vaccination is another pharmaceutical control intervention. It can be provided. This is actually preventive control intervention. So if you provide the vaccination, there is a chance that the individual may not get infection, and therefore there will be less burden on your treatment, and therefore there will be less infection as such. Screening, this is important in the cases where people don't show symptoms, still they carry the infection. And this is one of the aspects which we thought that we will be able to implement in our model, and we'll be talking more about it. So this happens whenever people are not showing symptoms, still they are carrying infection. So then certain kind of screening, certain kind of tests are required. And once you have known that people got infection, then you can treat them, or you can further put them in the either in isolation or in quarantine. And this brings to another kind of intervention, which is isolation for sick people and quarantine for those who are not showing symptoms yet, and the social distancing for the general public. So these are other kind of non-pharmaceutical control interventions. Awareness or information about the disease, that is also another control intervention, which helps people in reducing their contacts, and then therefore reducing the disease burden. So these are few. All these interventions have their own advantages and disadvantages, and definitely there is economic factor related with all of them, and the availability also. So you don't have for the availability of all control interventions which you can utilize. So this is a very basic model framework which usually people talk about. So usually what we do is that we divide our total population into certain compartments. So compartments means we classify them into parts. So we name them, let us say that the total population is N. And we are dividing the total population into, let's say, 4 compartments. So this becomes a general SEIR model. So susceptible, exposed, infected, and recovered. Susceptible are those individuals who are healthy and who are prone to infection. They can catch infection. Infected or exposed are those individuals who are exposed to the infection. However, the incubation is still going on and they are yet to show symptoms of the disease, and therefore they are uh, they are having pathogen, so therefore they are not the susceptible and they are not healthy individual, and they have not completed the incubation period, and therefore they are not classified as infective, so they are not actively infecting others. Infective population are those populations who have completed the incubation period and they are actively infectious, and therefore they will be they will be spreading the infection. Removed or recovered or immune population are those individuals in the population who had infection in past, and either by natural immunity or by treatment they have got recovered, and now they are immune to the disease. So sometimes the immunity might be permanent, sometimes the immunity might be temporary, depending on the class of the disease or depending on the particular pathogen which the individual is carrying. So with these compartments of the population, we can write a very simple differential equation model, and we can analyze that. I will be talking more about this specifically about the COVID-19, and my ideas will be about further making more compartments of COVID-19. So I am trying to quickly switch to the COVID-19 modeling. So this is the information. I think because of the pandemic, many of us are having this information. Still, just for the sake of completeness, I'm going to highlight a few points. So as of today, there are around 7 crore infections worldwide and 16 lakh deaths which have occurred as per the data of the entire world. This is one among the deadliest pandemic in human history, COVID-19, and this has caused consequences, tragic consequences, which has affected the millions of the population in the world. The outbreak of COVID-19 in India started on 2nd March 2020, and before recently the active cases coming down, these infective cases were on actively increasing trajectory. India has a high population density, and as the specific medication or treatment or vaccination is not available, and also the information of the transmission mechanism of COVID-19 is limited, it is really difficult to fight against the disease effectively. And therefore, many kind of interventions are supposed to be used, and they are supported. So for any intervention, we should have a systematic study, and once we have that systematic study, then we can get to know what will be the repercussion of that. So there cannot be a definite formula for controlling the disease for which very less information is available. And this designing an effective control strategy is one of the crucial factors, therefore, to curb the disease spread in such kind of outbreak situation. In this particular talk, we will be discussing about incorporating the effect of asymptomatic infective on the dynamics of disease. And we will be also talking about the proper use of face mask, hospitalization, and symptomatic individuals, and quarantine of asymptomatic individuals. So as I mentioned earlier, that the exposed individuals, they might not be showing any kind of symptoms. And so once somebody gets infection in case of COVID-19, what happens that some of them will show infection and some of them will not show infection, and still they are the carrier of the infection, and they can infect others. And since we don't know that, because people are not showing symptoms, and therefore it becomes really difficult to identify those individuals. Screening is one of the way through which one can check it, but this is how these infective individuals, they can spread the infection to others. And therefore, we thought that this idea of understanding how the asymptomatic individuals, yes. Okay, so how the asymptomatic individuals can impact the disease dynamics, which is COVID-19 dynamics. And this is another kind of face mask. So it is a non-pharmaceutical intervention, which we wanted to understand that how, and the quarantine is another intervention. So I will be discussing this in detail further when I come to my model. We focused on COVID-19 in India, and we have used the data set of 4 states for parameter estimation. I'm sorry, data sets of 3 states, Maharashtra, Delhi, and Tamil Nadu. So this study is around, we conducted this study till June or so. We have taken the data of June, and the study was conducted post that. So March to June was our study time period. And why did we choose these 3 states? Because at that time, these 3 states were having high impact of COVID-19. And that motivated us to choose these 3 states and see how the parameters of the 3 states vary. And along with the 4th one, data set was for the entire country. So the overall India data we have chosen. For the data, we have used the cumulative active cases of the disease only for the estimation of the parameters of the model. So yeah, here we reached to the compartments, and we have discussed already about the susceptible, exposed compartments and recovered compartments earlier. We have divided the infective population into 2 parts. One is the infective IS. IS stands for symptomatic. So those infective who are showing symptoms. And IA stands for asymptomatics. It means these are those infective which are asymptomatic. So susceptible is healthy, exposed is exposed, symptomatic infective, asymptomatic infective. H stands for hospitalized. So those individuals who are showing symptoms, they are seeking the treatment and they are hospitalized. These individuals also indicate that those individuals who know that, I mean, they have the confirmation of symptoms of the COVID-19, they are not hospitalized, but they are isolated. So in home isolation also. So if any individual is in home isolation or in hospital, then we have considered them in hospitalized class. Then the quarantined are those individuals who are actually moving from the asymptomatic class, and then they are quarantined. So the question is that why you quarantining the symptomatic individual, because you don't know whether they are infected or not. Many times, people come in contact with the infected individuals, and they might be thought of as having infection, like potentially have contacted with them, and therefore the quarantine, they might be getting quarantined, and therefore there is a fraction of a good fraction of those symptomatic, which is there, that goes to quarantine class, and therefore this QH becomes very important class, because asymptomatic otherwise cannot be identified unless until they are screened. And R is the recovered human population. So these are the individuals who have recovered with the COVID-19. So we shall have these assumptions. The assumptions are simple. First one is that there is recruitment rate, constant recruitment rate in the susceptible class. The susceptible individuals become exposed and exposed to the infection and join the exposed class, E class, on effective contacts with symptomatic and asymptomatic infected human population at the rate beta 1 and beta 2. So with the symptomatic cases, we are taking the rate as beta 1, and with the asymptomatic, we are taking as beta 2. So these are two different rates which we have considered for symptomatic and asymptomatic. A proportion CM, which lies between 0 and 1, of the population wear face masks. So we can say that if 60% of the population wears face masks, we can say that this factor is like 0.6. And so they are complying with the intervention. So this can be also understood as a compliance parameter. And epsilon m is considered to be the efficacy of the face mask. So all the face masks may not be equally effective, and therefore the goodness will depend on this factor epsilon m. And this usage of face masks actually reduces the disease transmission rates, and therefore beta 1 and beta 2 are modified to beta 1 minus epsilon m cm, and beta 2 1 minus epsilon m cm. So you can easily see that either if epsilon m or cm is 0, then this will be beta m. That means that either people are not using face mask, or the efficacy of those face masks is less, then there will be no impact. And if this factor becomes 1, so that means everybody is using face mask and all of the face masks are equally good, then this factor will become 0. So the disease transmission probability will go down. A fraction of exposed individuals show clinical symptoms and join the symptomatic class after showing those symptoms, while remaining exposed individuals move to the asymptomatic class after spending time in the exposed class. So this is the assumption here, and those asymptomatic individuals who show clinical symptoms with the passage of time. So we have also assumed that there is a movement from the asymptomatic class to symptomatic. So some individuals in the symptomatic class may show symptoms, and therefore the alpha is such rate on which this incidence is occurred. The symptomatic individuals are hospitalized at the rate of 5 years, and asymptomatic are moving to the quarantine compartment at the rate of gamma A. These are proportional to the population of these hospitalized and quarantine classes. These hospitalized and quarantine individuals recover at the rate gamma H and alpha H recovered respectively, and the symptomatic and hospitalized individuals can proceed to severe complications of COVID-19 and experience this mortality or the death at the rate μs and μh. So μs is the death. There might be higher mortality, and that's why it is considered there. And μh is the death in the hospitalization again, because these individuals are hospitalized. Of course, we have assumed that there is a natural death in each of the compartment. And we have assumed that once individuals have recovered, they do not get infection again. That means it is permanent to the time period of the model. So with this, we have reached to this kind of flow chart, the entire discussion which I have made. So susceptible individual, inflow, outflow. And then from susceptible, via interaction with the symptomatic, they are getting exposed, and via interaction of symptomatic, they are getting exposed and moving to the E class. From E class, there are two fractions. One is moving to the IA class, other is moving to the IS class. You can see the fractions are there, 1 minus A and A. So fraction A represents the percentage here. So if 10% are going to asymptomatic class, then A will be 0.1, and similarly here. So asymptomatic to symptomatic, they are moving at a rate alpha A. These 5 years are the rate of hospitalization, gamma A are the rate of quarantine, and this gamma H and alpha H are the rates at which these populations are getting recovered. So with this flow of individuals in the compartment, we get these differential equations. I've already explained all these terms to you and the parameters. So we get this system of 7 differential equations, and we use the mathematical tool after getting this differential equation to analyze them. So these are the description of the parameters which we have used. This can be accessed in the paper which is there, which is already published. So for biological models or disease models, it is very important to understand that these population always has to be non-negative, and therefore we form the biological feasible region, which is given by this bounded region invariant set for the system of differential equation. We also found the basic reproduction number, and this is the expression of the basic reproduction number. One can easily see that this basic reproduction number is directly impacted by epsilon m and cm. Higher the epsilon m or cm, then higher, lower will be the reproduction number. That means there will be this can be easily helped in controlling the disease. We obtain a disease-free equilibrium where disease does not persist, and this is given by this expression. And using the theory of differential equations, we obtain that this disease-free equilibrium is locally asymptotically stable if our basic reproduction number is less than 1, and is unstable if basic reproduction number is larger than 1. So this works as a threshold quantity, and our aim should be to bring it down to be less than 1. We also find that the model system has this unique endemic equilibrium. That means if R0 is larger than 1, there exists a endemic equilibrium, which also relates that the disease-free equilibrium is unstable. So once disease-free equilibrium becomes unstable, this guarantees the existence of endemic equilibrium. That means disease will persist for sure for R0 larger than 1, and the component of the disease, component of this equilibrium are given by this. That means these are all the equilibrium points which are given by this kind of relationship of the parameters. We observe that there are certain conditions. If these conditions are met, then this will be globally asymptotically stable. This disease equilibrium will be globally asymptotically stable, which means that that disease will persist and survive if R0 is larger than 1. So these parametric conditions need to be. So these are some mathematical analysis of the model. What is more important here in this model is getting the information via parameter estimation and data analysis. So in order to do the parameter estimation and data analysis, we used some of the model parameters we have taken from the literature, and because certain parameter values are known and there is no point in estimating them again. So we took these parametric values from the literature, and we have taken the data of active case of 3 states: Maharashtra, Delhi, Tamil Nadu, and then whole India. These data sets were for almost 3 months. You can check the specific dates in the paper. So, but these dates are in between March and June. So almost 100 days or so. So, for example, you can see Maharashtra. This is data is for almost 100 days, I believe, and for Delhi, I think it was around 115 days or so. So there are a little bit of difference in the data set. So these are the active cases of 3 different states, and these are the active case of the whole country data. We estimated 2 important parameters of our model system. I will come back to this point towards the end of the discussion, that why we have selected these parameters. So we have come to these 2 parameters we have estimated, beta 1 and alpha H. Beta 1 is actually our disease transmission rate, which is related with symptomatic individuals. And this I can show you here. This is beta 1 actually. This is related with our symptomatic individuals, so susceptible to symptomatic rate. And alpha H is actually our this quarantine class, which was of a symptomatic individual. So this is the recovery rate of that quarantine class. So that is the individual moving from the quarantine class to the recovered class. So these 2 factors we have, I mean these 2 parameters we have estimated. Rest other values are taken from this table, and after estimation of this parameter, we got these values. We can see that they are varying for different data sets. And with these values, we have estimated the value of R0. That means we have calculated the value of R0. R0 formula is already known to us. So once we get the value of these parameters, these values can be estimated. One can easily see that the time of study, the reproduction number was approximately 1.892 for Tamil Nadu, which was lowest there. And for Maharashtra, it was 2.5, which was highest. So this gives a reflection that how disease progresses. So higher the basic reproduction number, higher will be disease incidence. And this is how the model fitting was done. This blue curve is actually the fitted curve, and red dots are the actual data of 4 states. A, B, C, D represents again Maharashtra, Delhi, Tamil Nadu, and India data. And this shadowed region is showing the 95% confidence interval of this estimated value. So this is the best fit we obtained for the data, and we also made a prediction during that time. And the prediction says, if you see this blue curve is the prediction curve. So this blue curve is the prediction curve for all the 4 data sets. And if you see that we are inferring that Maharashtra, the curve is on the rising side. Delhi, the curve is on settling, and then it is showing that it will go down in the near future of this data. And Maharashtra, it showed that it will be going down, and I'm sorry, the first one is Maharashtra, it is going, saying that it's going upper side. And this one is Tamil Nadu. So Tamil Nadu, it is showing that that it will settle and then it will saturate. And for India, it is showing that it will be on the increasing side. So during that June. So if you see that we have tried to capture this that how this prediction will work. And for 3 cases, we have found that our predictions work relatively well, except this case of Tamil Nadu. So Tamil Nadu cases actually increased even in July. So our model predicted that it will be basically settling down. So that is what if you compare with the realistic data, this is kind of also better. So we have plotted the contour plots. We have plotted. So my time is up to 2 o'clock. Okay. Yeah. So we have plotted these contour plots in order to see that how R0 is impacted with respect to the epsilon m and Cm. I think we can easily see with the expression of R0 as well. And these are the density plots you can see, and you can see that there is a dotted curve, green dotted curve. So if you are lying in this region, that means this R0 will be larger than 1. So these are for again 4 states, four data sets for certain parametric values. So these contour plots actually helps in understanding how we can bring down R0 below unity by changing the parameters. Say, for example, here epsilon m and Cm, and in the next slide, this is phi s and beta 1. So this again shows the low density, the low values of R0 and to the higher values of R0. And this dotted shows the R0 equals to 1 curve. So we can have a control over R0 by controlling these factors, beta 1, phi s, and so on and so forth. Apart from the short-term prediction which we made using the data set, we wanted to make a long-term prediction as well. So these curves or these graphs shows symptomatic and asymptomatic populations. A green curve represents the symptomatic and blue curve represents the asymptomatic. And in the long term, if we use high efficiency and high compliance of the mask uses, we can see that disease will ultimately die out in all 4 cases. However, it shows that it will persist for a longer period in case the compliance or the phi s. So phi s is actually the factor which shifts the individuals from symptomatic class to hospitalized class. That is the rate of recruitment in the hospitalization, or you can also say that you are bringing the symptomatic individuals to the hospital. So if that rate is significantly higher, so this red curve are where the 5S is 0.025, and this light blue and light green curves are those, top curves are those where this 5S is taken to be 0. So here we want to see the impact of 5S, that is the hospitalization rate of symptomatic individual. And we see that if this hospitalization rate is higher, then you will be able to control the disease relatively earlier. So, and along with the compliance of the mask, it will be far more easier to do that, because then the incidence will be quite low, very low. This is fluorescent green curve, if you can see that one. So the similar pattern is followed by other 3 data sets as well. Higher the movement to higher the hospitalization of the symptomatic, that means you are providing more treatment, then there will be less, there will be high chance that you will be able to control the disease as early as possible. So this is about the population, symptomatic population. So these are all symptomatic populations only. So the symptomatic populations will be controlled. This is again for the case of asymptomatic population, and similar factor as was 5S was the case. Here we have considered the gamma A, and gamma A is the movement from asymptomatic class to quarantine class, just like the hospitalization for the case of asymptomatic for the symptomatic class. So let me show you. So this is gamma A. Gamma A is from asymptomatic to quarantine, and 5S was similar to symptomatic to hospitalization. So we wanted to see that how that gamma A factor works, and we have found the results. And but however, here we can see that this is very different. That it says that if asymptomatic individuals are not quarantined at a higher rate, that means if they are left untouched in the population, the disease prevalence of, or the asymptomatic prevalence, population prevalence is quite high, relatively quite high. Whereas when you use the face mask as well as the quarantine of these individuals, there is a chance that in the longer run, the disease will die out. And the similar pattern is followed by almost all states. So we have taken the similar parameters as we estimated, and we have used, I think we have modified a couple of parameters just for the sake of interpretation. So after getting these short-term and long-term predictions for the this infected population and the control interventions, we thought that because some states were having very small number of active COVID-19 population, and therefore the deterministic model sometimes may not be able to capture the realistic picture, because when the population is low, the behavior may not be completely deterministic, and therefore we moved to this noise-induced stochastic system. This is actually modified version of our deterministic system. So this part is the drift part, and the second part, DW1 part, DW1 to DW15, this is the diffusion part. So there is a way to convert these equations. The details are given in the paper. And here we are considering, so this part is coming from the differential equation system, which we have already discussed, the first part, which is written in this as dt, as the coefficient of dt. And this part, second part, is coming by diffusion. So there is a drift like movement and then diffusion. So around the average, there is a movement in all the possible movement in all the directions. So we converted our model system into this stochastic model system in order to understand the impact of the noise which is possible there in the system, and this is how we have drawn the model system using the possible changes in each class. And yes, so we have simulated the model the stochastic model system, and the simulation results are compared with the deterministic model system. So red color curves are our stochastic model system, and these black color curves are for the deterministic model system. It can be seen, these are for symptomatic and asymptomatic cases. So you can easily see. So for this, we have not used the data sets of the 4 states, rather we have simulated them, and then we wanted to see just the comparison because we did not have the data analysis for stochastic model. So we wanted to see what will be the comparison and how good these two results will be. And we observed that symptomatic cases and asymptomatic cases, they have, you can see that significant differences when symptomatic cases are concerned in the deterministic and stochastic cases. Similar thing happens for the hospitalization. That curve is significantly higher. In case of asymptomatic, this is not that significant, but still there are differences which one can see. And these differences will also depend on the parameters. We had some simulation run of our stochastic model, 100 simulation runs for 120 days. And these are the graphs of symptomatic and asymptomatic population. So we can easily see the distribution of the population on, this is for symptomatic population on the 80th day, 100th day, and 120th day. So the distribution, you can see simply that it is shifting, that initially it is dense about around 80 or 85, 80, 85, and which shifts to somewhere around 90s, and then more or less settles around 90s. So you can see the frequency changes as the time passes for symptomatic individuals. Similarly, the distribution, this is the distribution of asymptomatic individuals. So the asymptomatic individuals, lower numbers to distributed among the hires and then settling near the hires. You can easily see it, they're settling down there. So I'm sorry, these are actually 80th, 100th, and 120th. These are not 60, 80, and 100, 80, 100, and 120th. So this is what I was trying to point out at the very beginning. These are the parameters which we have chosen for the estimation. So beta 1 was chosen for the parameter estimation, and this alpha h was chosen for the parameter estimation. And here these parameters phi s and gamma a, they were chosen for understanding the impact of the parameters. So this is the result of PRCC, which shows that these are our model system is sensitive to these parameters. So from here we have chosen certain parameters, that which one we wanted to study or which one we wanted to emphasize in our study. So with this we come to the conclusion that we first developed a deterministic compartment model which describes the COVID-19 transmission in the population. Then our proposed model is fitted with the data sets, and certain parameters are estimated. We observe that the rate of transmission, that is beta 1, is quite high. So this is coming, this interpretation is from the parameter estimation. We estimated beta 1 and alpha h. So beta 1 is quite high in the Maharashtra. And if beta 1 is high, that implies that there will be high incidence. We estimate the basic reproduction number, and that suggests that disease transmission needs to be controlled. Otherwise, a large proportion of population will be affected, because R0 was significantly large. It was 1.5, 1.85 or higher for all the cases. And therefore, we believe that there should be other factors which should be implied in order to control the disease. We also underline certain short-term predictions for the 3 states of India, which we, with the help of our model, we concluded that for the case of Maharashtra, India, it will be on increasing side. That means the infections will be increasing. And for Tamil Nadu and Delhi, they will be on saturating and settling of the active cases. So this is what we have short-term prediction. We also had some long-term prediction as already discussed. So what is important here? So by a stochastic simulation, we have observed that the solution of the trajectories do not approach to the equilibrium level, rather they are distributed near the equilibrium values. So that is basically the idea of the stochastic model. And the distribution tells us that you will reach to a certain level with certain probability. It is not so. You can say that with every possibility there is a probability associated. So if the population is low, this result is very important, and that is I think I wanted to underline. And we have also shown the distribution of symptomatic and asymptomatic individuals because their behavior actually this is impacted. The behavior. So one important, I think, I missed this one. We also said that although the use of face mask in public can significantly reduce COVID-19. So we said that, how did we say this one? This one is coming from Epsilon and CM. So although the use of face mask in the public can significantly reduce COVID-19 in India, its use as sole intervention strategy may fail to lead the realistic elimination of the disease. So one should not take out that okay, only face mask can help in reducing the COVID-19 in India. This may be a wrong strategy. And so along with this face mask, there is a need of other strategies as well in order to have the eradication. So they can reduce, but they cannot help in eradication. So these are certain references, and I think this is it from my side. If there are any questions, I'll be happy to take them. Thank you.
Thank you very much. Hello.
Yes, please.
Professor your talk, it was really nice. There may be few questions from the room. Anyone ask questions? Any questions to the audience?
Sir, what are the most important things considered doing any model?
I cannot hear you clearly. What are the most important things?
What are more important things considered doing any modeling?
Oh, so in general, if you want to see what are the most important factors. See, in my personal opinion, or with my experience of almost 15 years in this area, I believe that the system description is one of the important ingredient. That's why I emphasized here in this talk as well at the very beginning. If we are going to model about a system, we should know everything, or everything possible, at least everything possible about the system. Because if our assumptions are unrealistic, then the model prediction will be not realistic. I will not say wrong, but they will not be realistic. They will be away from the reality. And therefore, this becomes very, very important that how you describe your system, or how you, because your assumptions will be based on your system description, what you know about your system. So if you take, or if anybody takes any assumption which is completely unrealistic, then one may land up to a model which may not give the results which will be closer to the reality. And therefore, we have to be careful with that. And another important aspect with the modeling is about prediction. So when you predict anything, you must mention that this prediction is under certain assumption. If my assumption changes, then my prediction will change. And that is very important, because one should not just get the interference of result from one statement. There are factors behind the statement. As we mentioned that though face masks are playing very significant role, however, they should not be considered as the sole intervention, because that will give a very wrong impression the general public if you say those people who doesn't understand modeling. And therefore, these two, in my personal opinion, are very important factors.
Okay, sir. Thank you.
Yes, is there any more question? Are there any more questions?
Yeah.
Sir, which programming platform you are using?
For data analysis, we have used R. For stochastic part, we have used MATLAB. That could have been done in R as well, but we have used MATLAB.
Sir, how did you estimated the values of the parameters alpha 1 and alpha h and beta 1? Did you use any particular function like fmin search in MATLAB or?
No, as I told you that the data analysis was done in R.
Okay.
So, yes. So,
Nice to contact Professor Prashant ji for this purpose.
Yes, and these details are also given in the paper which I shown in the very beginning. I hope my slides are still visible to you. So just give me 1 second, please. Yes, in this paper we have. Is it visible?
Yeah.
Yeah. So in this paper we have given the details of the tools and techniques we have used, or the software which we have used. We have given the details also.
So, any other questions? So, in that case, I would thank Dr. Prashant Srivastava ji for his lovely talk. The way he has written the SPI bar model by breaking that I factor into two, symptomatic and asymptomatic, and then creating a quarantine and home quarantine. That was lovely to know. And he has used them and got, the graph which he presented was very much, deterministic versus systematic. They were close to each other, meaning by that he had predicted regarding this the extinction of COVID-19. This model would have given a very nice result. Thank you very much, Prashant. Looking forward to be connected with you, and hopefully we would do something good with this research. Thank you very much, sir.
Thank you so much, Dr. Varun, and thanks are also due to the entire team of Bharat Ganita Prisad, Lucknow University for inviting me, including Dr. Pankaj Mathur, and as I mentioned earlier, my teacher, Professor Manju Gupta, and others. Thank you for giving me opportunity to interact with you, and it was really a pleasure talking here.
Thank you, sir. Thank you.
Thank you. So can I leave now?
Sure. Thank you.
Thank you.
Those who want to present some research papers, kindly wait for some time. We will be starting soon. Okay.
Okay, thank you.
Dr. Musharraf Ali, are you present there? Hello. Dr. Musharraf Ali, with the title of the paper Extensions of Beta and Related Functions. Are you there to present the paper? Okay, we will having next candidate, Miss Harshita Bharadwaj, with the title of the paper A Class of Analytic Functions Involving Q Analog of Dizok Srivastava Operator. Yes, present.
No slide is appearing.
सर शेयर्ड है नहीं मैम ये नेट डिस्कनेक्ट हो गया यस मैम
फिर से रिक्वेस्ट करो, फिर से रिक्वेस्ट करो। वाईफाई का और दूसरा और उससे तार इधर आ जाए।
for any non-negative integer n the q integer number nq is defined by nq is equal to 1 minus q's to power n upon 1 minus q's to power n minus 1 clearly q is equal to 0 for q belongs to 0 comma 1 limit q tends to 1 and q is equal to n the q derivative operator for f belongs to z The q derivative operator for f belongs to A is defined by del q f z is equal to f of qz minus f of z upon z q minus 1. And del q of z is to power n is nq, z is to power n minus 1 for all z belongs to u and n belongs to n. The convolution of two power series fz is equal to an z is to power n where n runs from 1 is to infinity and gz is equal to summation bn z is to power n where n runs from 1 is to infinity 1 to infinity. Convergent in the unit disk is the function h is equal to f convolution g with power series h of z is equal to summation an bn z is to power n from 1 to infinity. Consider a Q hypergeometric series denoted by phi rs and is defined as phi rs alpha I beta 0. Alpha i's and beta i's are the complex numbers. Beta I is not equal to q to power minus m for m is equal to 0, 1 are such that the denominator factors in the series are never 0. The symbol alpha I q n is defined as 1 for n is equal to 0 and 1 minus alpha I q up to 1 minus alpha I q is to power n minus 1 for n is equal to 1, 2, 3 and so on is the q shifted factorial and the q gamma function gamma qn is given by minus 1 q up to 1 q for all n belongs to n. The series phi rs converges absolutely for all z if r is less than equal to s and for z less than 1 if r is s plus 1. In terms of q gamma function, the q shifted factorial is written as q is to power alpha I q n is equal to gamma q of alpha I plus n in, times 1 minus q is to power n upon gamma q of alpha I where alpha is not equal to minus n. Also as q tends to 1 at the limit q tends to 1 phi rs q is to power alpha I q is to power beta j q minus 1 is to power 1 plus s minus r times z is equal to rfs alpha I beta z which is a well-known generalized hypergeometric function qz. We define a function g alpha I beta j qz by g rs alpha I beta j qz is z times I rs alpha I beta j qz and a linear operator hrs alpha 1 q hrs alpha q alpha I beta j qz which is from class A to A by hrs alpha 1 q f is equal to convolution of grs alpha I beta j qj and fz alpha 1 q n minus 1 alpha 2 q n minus 1 up to alpha r q n minus 1 upon q q n minus 1 beta 1 q n minus 1 beta 2 q n minus 1 up to beta s q minus 1 upon to whole to the power 1 plus s minus r a n z to power n, which converges absolutely in u if r is less than equal to s plus 1. The operator HRS alpha 1 q is called a q analog of Dijok-Srivastava operator. Let us put gamma qn minus 1 upon qn minus 1 beta 1 qn minus 1 up to beta s qn minus 1 raised to the power 1 plus s minus r. So that the summation alpha 1 q n minus 1 gamma n minus 1 a n z is to power n, where summation runs from n is equal to 2 to infinity. Now let f and g be analytic in unit disk. We say that f is subordinate to g in u, written as this for z belongs to u if there exists an analytic function fz defined on u with w0 is equal to 0 and mod of wz is 1, such that f of z is equal to z g of wz for all z in u. Also, f is subordinate to g implies that f of 0 is equal to g of 0 and f of u is contained in g of u. We now define a subclass SRSQ alpha 1 AB of f belongs to A by involving HRS alpha 1 q fz. Let del q HRS alpha 1 q fz upon HRS alpha 1 q fz is subordinate to 1 plus AZ upon 1 plus BZ, where minus B is less equal A is less than B is less equal 1. Denote by TRSQ alpha 1 AB, a subclass of analytic function. F belongs to SRSQ alpha 1 AB, where F is of the form Fz is equal to Z minus summation mod an Z is to power n from 2 to infinity. A is equal to 1 plus q times alpha minus 1. Alpha lies between 0 and 1, and B is equal to q. The class SRS q alpha 1 A comma B reduces to the class SQ star alpha RS alpha, which again reduces to the class SQ star alpha when alpha 1 is equal to q, R is equal to S plus 1, alpha 2 is equal to beta 1, and alpha R is equal to beta S. Note that the class SQ star 0 is equal to SQ star is the class of Q star like functions in U which and was studied by the reference 2. Let f be of the form 2 and let minus b less equal a less than b and less equal 1. If summation n from 2 to infinity cn is less equal b minus a, where cn is given by 1 plus b times nq minus 1 plus a alpha q n minus 1 times gamma n minus 1, and gamma n minus 1 is given by equation number 10. With r is less equal s plus 1 and real parameters alpha i's and beta i's such that beta is not equal to q's to power m for m is equal to 0, 1, 2 and so on. Then f belongs to SRSQ alpha 1 A comma B. Main results. Theorem 2. Let f be of the form 2 and let r is less equal s plus 1 with real parameters alpha i's and beta j's such that beta is not equal to q's to power minus m. Then f belongs to t s q r s alpha 1 A comma B if and only if the condition 13 holds. Putting A is equal to 1 plus q times alpha minus 1 and B is equal to q in theorem 2, we get the following result. A necessary and sufficient condition for the function to be in class T S Q star S R S alpha is summation n is equal to 2 from 2 to infinity nq minus alpha alpha 1 q n minus 1 gamma n minus 1 mod of an is less than or equal to 1 minus alpha. Further, if we put alpha 1 is equal to q, r is equal to s plus 1, alpha 2 is equal to beta 1, and alpha r is equal to beta s in corollary 2.1, the class TSQ star RS alpha reduces to the class SQ star alpha of Q star like functions of order alpha in U. Note that SQ star of 0 is SQ star. Theorem 3. The class TSRSQ alpha 1 A comma B is a convex class, and the radius result is let F belongs to TSR SQ alpha 1 A comma B, then the radius of Q star likeness of order alpha is given by R S star Q alpha TSRSQ alpha 1 A comma B is less equal infimum n greater than equal to 2. 1 minus alpha upon B minus A, Cn upon NQ minus alpha whole power 1 upon n minus 1. Thank you.
Any questions?
Are there any questions for Harshita? It was a nice presentation by Harshita. And next candidate to present is Dr. Khushbu Verma. The title of the paper is Optimally and Duality in Variational Programming Problem. Is Dr. Khushbu Verma available now? Okay, next candidate to present is Dr. Vinod Kumar.
Yes, sir.
Yeah,
Yes, sir.
Vinod Kumar, sir. The title of the paper of Vinod Kumar is A Secure and Efficient Authentication and Key Agreement Framework for Cloud Medical System. So you are kindly invited for the presentation, and you can share your screen.
Okay. Thank you, sir. सभी को नमस्कार. I am Dr. Vinod Kumar, Department of Mathematics, PGDB College, University of Delhi. Before this presentation, I wish to thanks to organized committee of this webinar. They give a chance to present my work in academic platform. During this corona pandemic, we have published this work in Journal of Medical System, Spencer US, with the SCI and Web of Science indexing. This work helps to the people in medical digital communication. So I am sharing my slides. This is visible. Hello. Hello. Hello.
Yes, sir, it is visible.
Okay, okay. I am presenting this paper. This is the outlines of this work. Oh, sorry. This is the outlines of this work. Introduction, families, the proposed protocols, security analysis, and performance analysis. And then conclusion. These are the following keywords in this presentations: cloud computing, electrical cryptography, telecare, medicine information system, mutual authentication, and medical data. Now, this is the introduction phase. First, I am discussing about the basic concept of cryptography. Cryptography is the way of secret writing or secure communication. According to mathematically, we discussed a crypto system have a five tuples P, C, K, E, D. So here P is the finite set of plain text means original message, or C means the finite set of ciphertext which is converted message from plain text. This K is the key space means set of all possible keys. Then for each key from key space, there is an encryption rule EK from this E and a corresponding decryption rule dk from d for each map ek from p to c and map dk from c to p are the functions such that satisfy this condition for all small x belongs to plain text. It's a basic mathematically definition of the crypto system. We are using two types of cryptography. First is symmetric key cryptography, or second one asymmetric key cryptography or public key cryptography. This is one of the example I saw shown here. Suppose this place is Alice as a user. This place is Bob, another user. Alice wants to send a plain text or a original message to Bob. Then says take X. Alice use this key secret key of Alice, or use encryption rule EK. Then convert this X into transmitted message Y. This is called ciphertext. Then this converted message Alice sent to Bob via communication channel or a internet. On receiving this message, Bob decrypts this message with the help of rule DK. Then convert this Y into X with the help of DK and this key, and Bob got a original message. So means in sympathetic key cryptography, the key is K is same for both users. Next, asymmetric cryptography or a public key cryptography. The one of the example here. Suppose this side is Alice, or this side is Bob. Alice want to send a message to Bob. So Alice convert this message in ciphertext with the help of PRB, private key of Bob, uh, and encryption algorithm EK. Then convert this X in Y with the help of PRB or X. This is Y is ciphertext. Then we send the ciphertext to Bob with the help of communication network. On receiving this message Y, Bob decrypts this Y with the help of public key and decryption rule DK. Then he got this X, the original message. So we have seen here this PRB used for the convert a plain text into ciphertext. This is private key of Bob. So here this decrypt this message with the help of this key PUB, this public key of Bob. So in this system there are two keys. One is private secret for every each user, or is public key, which is public in the communication system. So one of the example of the public key cryptosystem is RSA. Others example electrical cryptography, signature, algorithm signature schemes, and so on. Now, on these protocols, we use these following notations in this presentation. Now we come here the electrical cryptography. This is the branch of public key cryptography. An equation of non-singular elliptic curve is defined as y square equals to xq plus ax plus b mod q, where a, b are the element of the prime finite field. We have taken here non-singular elliptic curve means to satisfy this condition under mode P. The additive elliptic curve group is defined with a combination of the elements with this additional point. This point is known as the point at infinity. This take as a role as a key element, sorry, identity element of a group. So some basic property I am discussing here on elliptic curve. The scalar multiplication on the elliptic curve is defined Tp equals to P plus T plus P up to T time. Another property, take a sum of two point on a elliptic curve. If you take a P and Q2 point elliptic curve, then the sum of P plus Q is taken x3 or y3. So where is x3 is this and y3 is this. So where is lambda is the slope? If P not equals to this, then lambda is this. If P not, sorry, P equals to this, then lambda is this. So more information of elliptic curve and its property, you try to see this reference. Now come to the RSA algorithm. What is the need of the RSA algorithm I am discussing here? RSA is the first public key cryptography algorithm which is published by Ravi Shamir Edelman in 1979. This totally is mathematical concept. We use the modular theory and DCG, and then use the encryption and decryption rules. So my motive, we use here what is the difference between RSA and ECC. This ECC means electrical cryptography. So key size of the electrical cryptography much less to compare to RSA. So means storage capacity of a ECG is much less compared to RSA, and also security based protocols are more secure compared to RSA. So we adopt in our work this concept of the ECC based protocols. Now in this paper we also use the concept of the hash function. So hash function, a one-way hash function is a function which convert to in arbitrary length string to finite length of string. The base hash function have these properties: one way, weak collision resistance, and strong collision resistance. Now, in this proposed protocols, we have the following assumptions. There is a strong network connectivity in the communication channel. All the facilities available in the communication channel. And last one is the hash result, the random numbers, secret numbers stored in cloud server. The threat model of this work we have adopt. A dismiss this adversary. Know the public identifier of all the users and servers. Adversary can access the public communication channel. She can retrieve, modify, replay, inject new message, and discard any information in via communication channel. Now come on our protocols. So our protocols have a five component. First one is patient, doctor, healthcare center, cloud server, and body sensor. Our protocol have a five phases. First one, healthcare center upload phase. Second one, patient data upload phase. Third is treatment phase. Fourth is checkup phase. Or fifth is emergency phase. This is the architecture of these proposed protocols. This position of the patient, this position of healthcare center, this position of cloud server. This position of doctor, this position is the patient with body sensor. First, patient go to hospital, and hospital then take time, take a identity from patient, then communicate to cloud server and submit some information in cloud. So in this phase, healthcare center and cloud server mutually acknowledge each other and provide medical kit to patient. On receiving the medical kit, patient use maybe say one of the example medical watch. Yes. Then medical watch embedded device send all the medical information to cloud server. Cloud server and patient communicate to each other, and cloud server adopt medical report of this patient. Then cloud server and the doctor communicate to each other, and cloud server send all the informations, the medical report of a patient to doctor. Then doctor in this case, doctor send the checkup report, medical report, see the medical report and send the treatment report to cloud server. After that, in this fourth phase, the checkup phase, cloud server and patient communicate to each other, and cloud server provide a uh, checkup report to the patient, and patient take a treatment. Now, this is the basic formulation. We add here a special case is emergency phase. If patient have a emergency like heart attack or accident, then same time body sensor inform to cloud server, and cloud server inform to healthcare center, and healthcare center provide a
Hello, hello, Vinod Kumar, sir.
yes, yes.
I would like to just say that we are running out of time, so you can wrap it up in 2 to 3 minutes.
Okay, 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 okay.
Okay.
Oh, so yeah, this is the first phase for protocols. Healthcare central data upload phase. This is mathematical formulation of this phase. This is the patient data upload phase. This is mathematical flowchart of this phase. The treatment phase. This is a mathematical flowchart of this phase. 14 checkup phase. This is mathematical flowchart of this work. Last one is emergency phase. This is a mathematical flowchart of this work. Now come to the point is security analysis. The proposed protocols is secure and satisfy many following security properties. Now come to the performance analysis. What is the performance of our protocols? So we are discuss the three component here. Functionally features, compression cost, and communication cost. So first one is the compression. Functionally features. So our protocol satisfy the all properties, but the existing protocols do not satisfy all the properties. Now come to the comparison of the computation cost. So we adopt this model experiment on the base of Mohit et al. This is the tables. This is the existing protocols. The computation cost Chan protocol is this, Yang protocol is this, and Chow et al. Protocol is this, and Mohit et al. Protocol is this, and our proposed protocols computation cost is this. Is 2.179 seconds. This is much from Mohit et al. Cost. Next is communication cost. So we adopt the same model for communication cost. This is a communication cost comparison. Our protocol take the protocols, but this protocol not have emergency phase. So our protocol is a more efficient in terms of communication cost and more secure in the terms of security. This is a conclusion. The mutual authentication is established between healthcare center, cloud server, patient and cloud server, cloud and to document cloud server and patient and healthcare center. Further, the proposed protocol is strong against many security attributes. Next protocol is secure, efficient compared to other protocols in same domain. This is a real life application. This is the few references. Thank you. Any question, any query?
If anyone has question, you can kindly ask Dr. Vinod Kumar.
Yes, I'm ready.
It was a nice presentation, sir. And next candidate to present here is
Thank you, all of you.
Mr. Gyan Prakash Rathore. The title of the paper is Comparative Growth Properties of Analytic Functions of Several Complex Variables in the Unit Politics. So he will be presenting soon. Just wait for 1 to 2 minutes. बोलिए बोलिए बोलिए
Good afternoon, all of you. We are presenting the paper entitled Comparative Growth Properties of Analytic Function of Several Complex Variables in the Unit Politics. After in this paper, we introduce the idea of relative Neulina L-star order, and relative Neulina.
बोलिए
But
बोलिए
Neulina L-star or lower order of an analytic function of several complex variables with respect to an entire function of several complex variables in the unit politics. Also be introduced the
बोलिए
also be introduced grow property position of two analytic functions of several complex variables in the unit politics on the basis of their relative nominal star order and relative nominal star lower order. Introduction a function f analytic in the unit they group z such that not greater than one is said to be of finite order. If there exists a function such that the identity function t of r comma f is equal to 1 to 5, this function satisfies t of r comma f less than 1 minus mu for all r equal 0 less than or not less than or less than 1. The greatest lower bound of all such numbers means called Neulina order of f. Thus, the Neulina order rho of f is given by this definition. Similarly, Neulina lower order lambda f of f is given by lambda f is equal to inferior first 1 log t r comma f upon minus log minus r. In this section, introduce the notion of Neulina L order of an analytic function as given in U is equal to this, and where L is equal to L of 1 upon minus R is a positive continuous function in the unit engaging L of 1 upon A upon minus R similar to L of 1 upon minus R as R tends to 1. Positive constant in the following manner. Definition first, introduce the analytic in Neulina order and the lower order lambda of f are defined as this. Now we introduce the concept of relative star order and relative star lower order of t function with respect to another g unit base u, which are as follows. Definition of the analytic name to be an entire, then the relative list of order of with respect to G denoted by this. Similarly, relative star lower order with respect to denoted by lambda G to the power star of is given by function when G of Z is exponential Z. The definition coincides with the definition of the Neulina L star order and the Neulina L star lower order. Now we see the notion of variable with several complex variables in this section. Let R be an analytic of several complex variables. Z1 in politics. Definition T denotes the characteristic function of several complex variable and G here is entire function of several complex variable. And they the list of with respect to G denoted by this. And similarly, the relative list of lower order of f with respect to G denoted by lambda G to power L star of f is given by this definition or relative so where L is equal to this, L similar to this is a positive function in politics, aging slowly. This in this paper, study how the computer to analytic function several components in the mythology. On the basis of their related novel listed order and related and linear order, we do not explain the standard locations in the entire function variable. Those are available section. In this section, the main feature Napier theorem first is this and proof of this theorem. Euler theorem and theory and proof of this theorem. And last reference is thanks.
Okay, so Mr. Gyan has presented his paper, and the next candidate to present is Dr. Saria Banu. Title of the paper is on weighted lacunary interpolation. Is Saria Banu available here? So we will be calling the next candidate, Mr. Satyendra Pratap Singh. Mr. Satyendra Pratap Singh, are you there? Mr. Satyendra Pratap Singh. Next candidate to present is Miss Ananya Divedi. Ananya Divedi, are you there to present the paper?
Yes, sir.
Okay, you can go on and share your screen there.
Okay, sir. Sir, it is visible.
No, not yet. Have you shared your screen? It is not
Yes.
visible here.
Sir, please give me 2 minutes. I will try.
Yeah, yeah, sure. ऐड अगर कोई और हो तो ऐड कर लीजिएगा फोन में वो ज्वाइन कर लीजिए एक मिनट
तो श्रुति सर आवाज नहीं आ रही है.
Yeah, I am seeing that. Ananya, are you there to present the screen?
Yes, sir. Sir, I'm ready, but there is some network issue, so I'm trying.
Okay, we can try tomorrow, Ananya. So we are not going to waste time on that. You can try tomorrow. Okay, we will give you a slot tomorrow also.
Sir, after that, sir, I will try. Sir, please give me 2 minutes.
Yeah, sure. We are just having a next candidate, and you can try after that. Okay. So our
Okay, sir.
last candidate for today is Dr. Yogesh Naran. Uh, is Yogesh available? Is Yogesh available today? So I think Ananya, you can try for some time. You can try out because all the candidate lists have finished for today. So either you try it. She left.
Yes, sir.
You can try sharing your screen now. because you are only the last candidate out there in today's session. If you are having some internet issues, you can try tomorrow as well. She's trying to connect. ये चल जाता है हाँ वो आए तो क्या कर रही है रैप कर दें 2 मिनट Ananya, are you going to present today or not?
Sir, actually there is network problem, so I present it tomorrow.
Okay, okay. We will be providing you slot tomorrow. Okay.
Okay, sir.
We will message you in the WhatsApp as well as email.
Okay,
So
sir.
I think for today's session there is no one left, and I would like to request Professor Pankaj Mathur sir to wrap up the today's session. So he's going to say some few words.
So, thank you, Varun. I'm thankful to all the participants and all the speakers who have spoken today, and I'm thankful to all the students who have joined this session for today for this webinar. Hope to see you tomorrow. Tomorrow we start early. We have Professor Rana D. Prasad from Iowa State University. He will be speaking on a mathematical model on species, and he starts at 8:45 a.m. Indian Standard Time. So it's quite early tomorrow. So it is requested to all the candidates to please join us at 8:40 so that we can telecast at the lecture of Professor Rana D. Prasad on time. And the second speaker today, tomorrow would be Professor Arvind Mishra. He would also be talking on COVID-19 mathematical model. So tomorrow will be quite interesting days, quite interesting lectures from two great professors, and hope to see all of you tomorrow again. Till then, goodbye, and tomorrow it would be online. So hope to see you all tomorrow again. Paper presentation will be after our invited lectures. It most probably it would start from 11:15 a.m. Hope to see you again. Thank you.
Okay, so all of you can leave now, leave the session now, and we will be starting tomorrow session as per the given schedule time. So see you all tomorrow. So you can leave the today's session. Okay.
चलो चला जा